what we find out is by combining mosunetuzumab and polatuzumab, it doesn't really seem to matter what their prior treatment is, or especially for patients who had or had not had CAR T cells prior to this treatment. The overall response rate and complete response rate are pretty similar across the subgroup analysis. But I have to caution that the number of the total treated patient is still relatively small. And this conclusion might change once we treat more patients. But at the present time, based on the data we have so far, we have not seen a differences between patients, for example, with high-grade lymphoma, transformed diffuse large B-cell lymphoma, or patient with prior CAR T-cell therapy, but relapse or primary refractory to CAR Ts. The response rate holds the same. The most common ones are fatigue, diarrhea, and neutropenia, but patients usually made a full recovery from this. And the treatment emergent side effects, I think the one that we worry about the most is second release syndrome, because of the use of mosunetuzumab. So in these studies, the incidence of second release syndrome is all confined to cycle 1, and all incidences was grade 1 and 2. So all patients except one patient had grade 2, and all the other had just grade 1, and all second release syndrome event resolved to to pre-treatment baseline without really use of tocilizumab or vasopressors. So in a nutshell, the second release syndrome incidence is actually much lower than using mosunetuzumab alone. So the combination of mosunetuzumab and polatuzumab turned out to be quite safe. The mosunetuzumab and polatuzumab related mortality is only seen in one patient, and side effect that leading to discontinuation of treatment was seen in 3 patients that were deemed to related to mosunetuzumab and 6 patients that were deemed to polatuzumab. So relatively speaking, this combination regimen is well tolerated and is quite tolerable in patients who are heavily pretreated with at least 3 prior lines of therapy. These are the patients enrolled in the studies and with a sizable numbers of patients with prior CAR T-cell therapy.